Good day. Today we are going to discuss the management of patient with depression. So for the assessment, we should assess for factors that may lead to depressive behavior such as suicidal thoughts and behavior, slow mental processes, disordered thoughts, feeling of despair, hopelessness and worthlessness, guilt, anhedonia, or the inability to experience pleasure, disorientation, generalized restlessness, or agitation. Sleep disturbances, early awakening, insomnia, or excessive sleeping, may it be anger or hostility, may not be overt, it can be covert as well. And rumination, delusion, hallucinations, or other psychotic symptoms, and diminished interest in sexual activity, fear of intensity of feelings, and lastly, anxiety. And for the diagnosis, it should be ineffective coping, or this is the inability to form a valid appraisal of the stressors, inadequate choices or practice responses, and or inability to use available resources. Good day. I am Nurse Ian, and may I know your name?
I'm Apple Trilacop,
May I know your birthday?
September 2, 2001.
Thank you. So today is May 6, and today we are going to be talking about something that may be too sensitive for you, may be personal. This is not to make you feel uncomfortable, but rather help you, okay? Would that be fine with you?
It may be hard, but I'll try.
Okay, thank you. It is okay, ma'am. If you do feel like crying, just do so. I am encouraging that because it is normal for us to cry when you get overwhelmed, and if you do feel sadness, it is normal. So let me ask this for now. How are you feeling right now overall?
Lately, I do feel listless, and I do feel like not eating at all. I do also feel extreme sadness at times where I do feel that my chest is about to burst. There are also times that I do feel that I'm worthless and I do not deserve to be here talking up people's time.
Well, Ma'am Apple, I do sympathize with you. In the past, when you experienced these things, what did you usually do to take it off your chest or your mind?
I do watch funny videos, but then it is not enough right now.
Mm. This right now is real, and you can rest assured that you are not being judged in whatever you're saying right now, whatsoever. And I have also observed you in the past, ma'am. And I do have this question. Have you tried other things than watching these funny videos? Because maybe there are other ways that you're doing to cope with what you're feeling.
So far, I have not tried any in particular.
I may suggest you can read some books, and I do have some recommendations if you would be doing that. You can also do exercising or painting if it's really calming for you, or it is your hobby to draw or make some art, and the situation that you are in is really hard, honestly. At least you are trying, right? And I do feel that you do have a lot in mind right now, based on your facial expression. Why not try journaling? And your journal, you can write whatever you want. You can say whatever things you want to say, that you're gonna say to other people. You can also show all the emotions that you're holding back on the journal. And if it would be okay for you, it would be nice if you can also share the journal to me so that I can know what you're feeling for honesty. And I do hope you can try. Would you be able to do that? Journalizing?
Okay, I'll try.
Thank you. So that's it for now, ma'am. And later on, after you tried this thing, you can just go back to me and show the journal if that would be fine with you. And you'll see each other around. Okay? Thank you, ma'am. So for the evaluation, there are three phases when we are dealing with the patient with depression. So first is the immediate phase wherein the patient is free from self-inflicted harm throughout the hospitalization period, and he or she engaged in reality-based interactions within 24 hours. The patient also should be oriented to person, place, time within 48 to 72 hours. And lastly, express anger or hostility outwardly in a safe manner, for example, talking with staff members within 5 to 7 days. And for the stabilization period, the patient should be able to express feelings directly without congruent verbal and non-verbal gestures or messages. May the patient be free from psychotic symptoms. And lastly, for stabilization, is the patient should be able to demonstrate functional level of psychomotor activity. And for the next phase, the community phase, the patient should be able to demonstrate compliance and acknowledge of medications if there are any prescribed medications to the patient. Demonstrate and increase ability to cope with anxiety, stress, or frustrations. And the patient should also be able to verbalize or demonstrate acceptance of loss or change, if any. And lastly, identify a support system in the community. And throughout that process of interacting with the patient, whatever that we had done, you should document it, because if it is not done, or if it's not documented rather, it is not done. So that's it. Now we're going to talk about how to manage a patient with a personality disorder. So first, we should do the assessment. So we should assess the factors that may lead to antisocial personality behavior, such as impulsive display of temper, inability to express feelings verbally, physically inflicting harm to himself or to others, attention-seeking behaviors, and ineffective coping skills. For the diagnosis, it would be risk for self-mutilation. This is the behaviors that indicate potential for deliberate physical damage to self that is not intended to be fatal. Good day, I am Nurse Ian, and today I'm going to ask you some questions and many things, but rest assured that anything that you will be saying is confidential and I will not share it to anyone, okay? So, may I know your name first?
Can I trust you on that?
Yes, for sure. Cross my heart, hope to die.
Okay, Apple, Laka.
May I know your birthday?
Why are you asking this?
Uh, this information has helped me to confirm your identity, and that's why I'm asking it. I do really need to just know it, and I'll not just share it to others. I do promise. Thank you.
Okay, September 2001.
I'll be checking your arms and legs if it's okay with you. Would you be able to stand up for me? Okay, let me check. Stand.
Stop touching me.
Oh, I'm sorry. Can you raise this hand? Can you raise this hand? Yes.
This one?
Yeah. Yeah. Okay. Okay.
Are you done?
Yeah, very done. Perfect. Lately, have you experienced any thought of doing self-harm or anything? What kind of thoughts do run on your mind right now?
I still do. Mm,
Can you tell me what kind of emotions you felt during those times?
I felt so sad to the point that I feel like I'm not worthy to be here and taking up others' time.
Ma'am, you are not a burden at all. And also, it is our responsibility as your caretakers, as nurses, as doctors, to look after you. We do hope the best for you, ma'am. And do you want to share more about this instance where you want to harm yourself?
Well, not really. I did try to control my emotion, but nothing works.
Have you tried writing down things? Like how you feel that time when you are in this instance, when you're thinking about self-harm? Maybe you can try exercising or doing some common things such as reading, drawing, singing, and many more. If you feel this way again, you can try these things. If you want to try them. Any of those things.
Okay, I'll try.
Also, have you tried interacting with other people in this facility other than the nurses, the physician?
Honestly, no. Not yet, as I am shy and I also do not want to be trouble to others or burdens to them.
We do not think of you as a burden, ma'am, okay? I am right. I am assuring you right now, you are not a burden at all. You may feel this way, but this is for you. And you are not a burden at all. Maybe when you try communicating with other people in the facility or in, maybe you can find someone who can sympathize with you or experiencing the same condition with you. Maybe you will learn something out of those person. There's a big chance that you can find someone that you can make you more engaged talking about your feelings. So great, you can just blurt out anything that you have thought about. Do you want to try that?
That is quite true, but I'm still quite hesitant, but I will try. I do hope you can listen to me again during our next session.
I'm glad to do so, ma'am. I do hope you can practice the things that I have said earlier. You can choose one of them, just journalizing or just interacting with more people around you. I'm ready for it. I do hope that everything works out. Okay?
Okay.
We are going to talk about the evaluation. So for the evaluation of a person with a personality disorder, there are three phases as well. First is the immediate, where we assess for the patient to be safe and free from injury throughout hospitalization. You should also refrain from harming others or destroying property throughout hospitalization. The patient should be able to respond to external limits within 24 to 48 hours. And lastly, for the immediate, the patient should be able to participate in treatment plan, for example, talk with staff or participate in group activities for at least 30 minutes twice a day within 24 to 48 hours. And next, for the stabilization phase, this is where the patient had eliminated acting out behaviors such as temper tantrum, self-harm, and suicidal threats. And the patient should also be able to develop a schedule or daily routine that includes socialization and daily responsibilities. And for the last phase, the community phase, if by chance the patient has been discharged from the hospital, the patient should be able to independently control urges for self-harming behavior and demonstrate alternative ways of expressing feelings such as contact with a therapist or significant other, especially the support system. So the patient should have a strong support system. And through all of that, assessment, implementation, and evaluation, we should now document all the data that we had gathered and also had been done for the patient, because what is not documented is not done. So now we are going to talk about the conversion disorder, on how we should manage a patient with this disorder. So first is the assessment portion. We should assess the factors that may lead to conversion disorder behaviors, such as presence of physical limitation or disability with indifference to or lack of concern about the severity of the symptom. Next is to refusal to seek health care for the physical symptom, lack of insight into stress, conflict, or problematic relationships, difficulty with feelings of anger, hostility, or conflict, decreased ability to express needs and feelings, and lastly, the secondary gain related to the physical symptoms or disability. And now for the diagnosis, it is ineffective coping. This is the conscious or the unconscious attempt to disavow the knowledge or meaning of event to reduce anxiety and or fear leading to the detriment of health. And let's proceed with the patient interaction and how should we plan for the patient interaction. Hello, I am your nurse for today. I am Ian. May I know your name?
I'm Apple Lakap.
May I know your birthday?
September 2, 2001.
Okay. So today, ma'am, we are going to talk about some sensitive matters. It may be personal for you, but would it be fine for you?
Sure.
Also, I'm just going to ensure that everything that you will be saying today will be confidential, and also it will only be used for treating you, for helping you. Okay. Have you been doing your assignments while you were here?
Yes, I am accomplishing event every single assignment given to me.
That's great. As you still need to study even though you are here? Because in a way, would you like to attend a group session where everyone share a piece of themselves?
Um, I think that will be quite a tear-jerking session. So, I think it will be a great idea.
Yes, it will be really a tear-jerking session where they will really be opening up their hearts to each other. And Nikki, have you experienced any problems, maybe at school, home, or within your circle of friends since you are here in the hospital?
Well, I do not know if I should tell this story to others, but at home I'm really quite quiet that I do not want to interact with them so much.
Do you have a specific member of family that you are comfortable communicating your emotions?
I do trust my brother. I think I can talk about everything to him.
Would it be fine to have your buddy here with us right now?
I think that is fine, but maybe next session, since I was not able to call him before this session.
Since we cannot have your brother, I guess we can just do something about that in the next session. But now, since your brother is not here, would you be able to share more about how are the quiet, how you are the one who is quiet in the family?
Gladly, well, I am a quiet one because I do hate when all the ideas in the family are so overwhelming to the point that there are a lot of arguments. That's why I'm scared to open up with them.
What kind of arguments are usually present during those times?
Most of the time, it is about who is much better, who has more money, and about the government, and so stressing.
Now, that must have been so hard for you, ma'am. But I am proud of you right now as you share these things with me. And, well, I can judge your family based on that. And I will not do such a thing and all. But I do hope that these things could be mended since it's affecting you, ma'am.
I do hope so.
Let us leave those things for now and let us talk about this group of people that I would like you to meet. It is a group of people where they suffer the same conditions just like you do. And also, just a warning, there are some groups online that are a scam. So, maybe your family is searching about your condition and what they can do, and this might pop up. So, just a heads up so that you can inform, especially your brother, since you're much closer to him and you can open up your feelings to him. So maybe just a heads up.
Okay, I'll try.
Yes, that's it. I would like to remind you that your meals would also be scheduled, just like what you had in the past. And so here is the schedule. You can use that. And I do hope that you did have a great time talking with me. And thank you for cooperating.
Thank you, nurse.
Now we are going to talk about the evaluation. So for the evaluation, we also have phases for this. First is the immediate phase wherein the patient should have identified the conflict and underline the physical symptoms within 4 to 5 days. They should have already identified the feelings of fear, anger, guilt, anxiety, or inadequacy within 4 to 5 days. And lastly, verbalize step problem solving process within 4 to 5 days. For the stabilization phase, the patient should be able to verbalize feelings of guilt, anger, and fear, anger, guilt, or inadequacy. And the patient should also be able to verbalize the knowledge of illness, including the concept of secondary pain, and demonstrate use of problem-solving process should be done during this phase as well. So for the community, we should be able to negotiate resolution of conflicts within the family, friends, and significant others. And that's it. Then we document all the findings, the data that we had gathered throughout this interaction with the patient, and that's it. So now we are going to talk about the management of patient with anorexia nervosa. So for the assessment, we should assess the factors that may lead to anorexia nervosa. Anorexia nervosa, just an additional information, is an eating disorder. So first, we should assess for denial of illness or resistance to treatment, inability to ask for help, problem solve, meet basic needs, meet role expectations, and also we should be able to assess feelings of helplessness and powerlessness, depressive behavior, anxiety, guilt, anger, suicidal ideas, feelings of manipulative behavior, hyperactivity, sleep disturbances such as early awakening, and also social isolation, decreased sexual interest, rumination, refusal to eat. There's also signs of dread of certain food or types of food such as carbohydrates, because they do feel that they will gain weight if they did eat these carbohydrates. Disgust at thought of eating, preoccupation with food, hiding or hoarding food, preoccupation with losing weight, unceasing pursuit of thinness, intense fear of becoming obese, family problems, low self-esteem, problems with sense of identity, delusions, and lastly, body image distortions. For the diagnosis, it should be ineffective coping. This is the inability to form a valid appraisal of the stressors, inadequate choices of practice responses, and inability to use available resources. So it's the right planning and implementation where we interact with the patient with anorexia nervosa. Good day, I am Ian Angela. It's the ear nurse for today. May I know your name?
Apple Lakap,
And it's your birthday now.
September 2001.
So right now, ma'am, I'll be assessing your physical status, but it will not be quite long. After this, you can have your meal in the hall since it is almost lunchtime. Shall we get started?
Hi.
So, can you stand up for me? So, I'll be touching you, ma'am, just for measurements.
It's fine.
Ma'am, can you step on the scale just for a moment? Okay. Thank you, ma'am. And now sit here while we proceed with our discussion. Expected it for now, ma'am. So, ma'am, how are you feeling lately?
I do feel some immense pressure. Then at some point, I can't move my arms and legs.
What are your usual thoughts when this thing occurs? This feeling of paralysis?
I'm thinking about the task that I do need to accomplish as I am ahead of the promotion team in my workplace. That is why I thought it is just a stress.
That might be it, ma'am. And have you opened up this conversation with your family in the past?
I did not, as I am the breadwinner in my family, and I do not want to disappoint them.
It must be really hard shouldering all of these things by yourself. Have you tried things to do with the paralysis induced by stress?
I did. I use a stress ball. You know that. I do that whenever I feel so stressed and to relieve myself from feeling the paralysis.
Well, that's great, but since stress ball is just one way of combating or lessening the stress, let me now teach you another way to reduce the stress that you're feeling. So, let's do some breathing exercise. So, now copy me, ma'am. Inhale, hold, exhale. Inhale, hold, exhale. Inhale, hold, exhale. Now close your eyes, ma'am, and let's do the breathing exercises again. And while we're doing it, you may think about the most comfortable place that you have ever been. Inhale, exhale. Inhale, exhale. Inhale, exhale. Do you feel something changed?
Yes, my chest feels so much lighter now, and thank you.
You're welcome. Thank you as well for being open to me, which is really a hard thing to do, especially if it's about the family or about the career. And I guess that's it for now. I hope you may join the session where the others are having their meal, and I do appreciate the time that we shared with each other right now, as this helps our band get strong. So that's it. So now we are going to talk about the evaluation. So there are also phases when it comes to evaluation for a person with anorexia nervosa. For the immediate phase, the patient should be free from self-inflicted injury throughout hospitalization, participate in treatment program, for example, participating in at least one activity per day or per shift, or 2 interactions per shift within 3 to 4 weeks. The patient should be able to demonstrate beginning trust relationship with others within 3 to 4 days, verbalize recognition of perceptual distortion, just distorted body image within 4 to 5 days, identify non-food related coping mechanisms, for example, talking with others about feelings, or journaling within 4 to 5 days, interact with others in non-food related ways, maybe playing games or doing some hobbies. And lastly, for the immediate phase, the patient should be able to demonstrate increased social skills, for example, approaching others to talk, make eye contact, and so on and so forth within 3 to 4 days. And now for stabilization phase. This is where we demonstrate more effective interpersonal relationships with the family or significant others, exhibit age-appropriate behavior, for example, completing school assignments on time without prompting from staff, demonstrate change in attitudes about food and eating, verbalizing increased feelings of self-worth, demonstrate decreased associations between food and emotions, and lastly, verbalize knowledge of illness and medications if there are any prescriptions given to them. And for the community phase, there should be able to participate in continuing therapy after discharge if appropriate, and then demonstrate independence and age-appropriate behaviors, and lastly, verbalize a realistic perception of the body, because patients with anorexia nervosa do have, again, distorted body image. And then, again, we are going to document all the data that we had gathered and all the procedures that we had done to the patient. And that's it. Thank you.